we're going to cover 6 symptoms and signs that can be linked to bowel cancer. However, before we cover these, I want to point out that some of these symptoms are not specific to bowel cancer and can be caused by other conditions. Nonetheless, if you do have any of these symptoms, it is worth speaking to your doctor, who can help you try to find the underlying cause. The first important symptom to be aware of is a persistent change in bowel habit. This means a change to your normal bowel habit that's gone on for more than 6 weeks and isn't getting better or returning to normal. For example, you might find that you're having bowel movements more often or experiencing looser, runnier stools, sometimes accompanied by tummy pain. Either way, if you've noticed a persistent and ongoing change to your bowel habit, you should speak to your doctor. The second important sign to be aware of is blood in the stool. This can be obvious, visible blood or microscopic blood that's mixed in with the stool, detected through a fecal immunochemical test, also known as a FIT test. Although seeing blood in the toilet can be scary, it's important to remember that there are many non-cancerous causes of this, such as hemorrhoids, commonly known as piles. Either way, if you have noticed bleeding from your bottom, you need to be assessed by your doctor to help find the underlying cause. The third important symptom is unexplained weight loss, especially if you're aged over 40 and have lost more than 5% of your total body weight in the preceding 6 months without intending to do so. This means you haven't been dieting or increasing your exercise. While many factors can cause weight loss, if you also have rectal bleeding, abdominal pain, and you're aged 40 or older, this raises suspicion for possible bowel cancer. The fourth sign that needs to be investigated for possible bowel cancer is a mass in the abdomen, rectum, or anus at any age. There are many possible underlying causes of this sign, which may not be related to bowel cancer, but it is something that needs further exploration. The fifth symptom is abdominal pain, discomfort, or bloating, always brought on by eating. This sometimes results in a reduction in the amount of food eaten and weight loss. The sixth symptom is feeling tired all the time. Although this is a vague symptom, your doctor might check your blood for iron deficiency anemia, low iron causing low hemoglobin levels. If this is found, they may investigate further, taking into account your age and other possible causes of why you might be feeling this way. It's important to note that many people with these symptoms or signs don't have bowel cancer, as other health problems can cause similar symptoms. However, it's crucial that if you do experience any of these symptoms or don't feel right, you should see your doctor or family physician, who can investigate further. Knowing these symptoms and signs and acting on them as quickly as possible could mean that if you do have bowel cancer, it may be diagnosed earlier when it's much easier to treat. People whose cancer is diagnosed at an early stage have a much higher chance of successful treatment compared to those whose cancer has spread further. Also, don't be embarrassed or ignore any of the symptoms. Doctors are accustomed to seeing people with bowel problems, and they'll do their best to help you access the right tests and investigations if needed. Finally, it's important to be aware that in some cases, bowel cancer can block digestive waste from passing through the bowel, known as a bowel obstruction. Symptoms of a bowel obstruction can include intermittent and occasionally severe abdominal pain, unintentional weight loss with persistent abdominal pain, constant swelling of the abdomen with abdominal pain, and vomiting. A bowel obstruction is a medical emergency. If you suspect your bowel is obstructed, you should go to the emergency room immediately. Thank you for watching, and until next time, eat healthy, live healthy.